I really enjoyed that first talk, actually, especially talking about how we really need to know about our bugs before we start implementing our WASH interventions, because I will be talking about my favorite parasite, Schistosomiasis. So I'm from the Global Schistosomiasis Alliance, and just to let you know a little bit about who we are, we're a multi-partner organization representing a whole range of stakeholders working on schistosomiasis. So ranging from governments, multilateral organizations, NGOs, academia and research institutes, and the private sector. These are very much our founding partners, how we started, but now we're pretty much expanding to all stakeholders who have a shared vision of elimination of schistosomiasis as a public health problem. That's who we are. And why are we so obsessed with schistosomiasis? Because of its global health impact. So it's incredibly prevalent as a disease. It's caused by infection with the schistosome worm, a little fluke that lives in the blood system of mammals. And currently it is estimated to infect between 200 and 250 million people, with over 700 million people at risk of infection, a huge geographic range, 74 countries are endemic, and the morbidity that it causes is really devastating. So apart from it can cause severe organ damage and later organ failure and mortality, deaths per year, it also causes severe morbidity and subtle morbidity, which just leads to a huge amount of suffering and chronic illness. Now, these figures just show the actual human impact, but you also need to know that there are a wide range of schistosome species infecting animals, and this is actually also a disease of huge veterinary importance as well. So going back to the whole life cycle, you need to know your life cycle in order to implement your control, whatever your control intervention is going to be. I wanted to take us through the life cycle of your average human schistosome. So starting with someone who's infected with a pair of adult worms. They're producing eggs, and the eggs will make it out with urine and feces into the environment. They will then enter a water system, hatch out into Myrissidia, which is a larval form that specifically goes and finds aquatic snails, specific species of aquatic snails, and infects them. Now, inside these aquatic snails, there's asexual reproduction. So there is a very important life cycle stage that goes on, that goes on in the snail. And this means that one Myrissidium will lead to thousands of the next larval stage, Cercari. And it is Cercari that can infect humans when they go to bathe in the water. And they do this by actually locating the skin and penetrating the skin into the blood system underneath. So it's water contact that we're talking about here. And you can see how much of this life cycle is based in the aquatic world. So that's something to be aware of. So we now know that infection plus water contamination plus compatible snails plus water contact, that's what leads to schistosomiasis transmission. If you want to control schistosomiasis, you need to be aware that it is both a waterborne and a vector-borne disease, that transmission occurs through direct contact, not the fecal-oral route, but through direct contact with contaminated snail-infested water, and that this direct water contact can be in permanent water bodies or even temporary water bodies. They also act as transmission sites. So where in the life cycle can we intervene to reduce and interrupt transmission? Well, we can treat with praziquantel, our available drug, and we can do this killing off the adult worms. We can stop the eggs from reaching the water system, so stop the eggs from reaching where the snails live, basically preventing the snails from getting infected. And that is where sanitation can come in. We can prevent snails from getting infected, perhaps using resistant snails, snails that do not succumb to schistosome infections by Myristidia. We can actually get rid of the snails through snail control. And we can prevent contact with infested water. And that could be through the provision of alternative safe water or and behaviour change. So trying to change that water contact behaviour so that people go to safe water rather than the open water sources. So looking a little bit at water and schistosomiasis, water development programs, there are many that have happened and I'm sure will happen, and they're used for food sustainability and for the creation of energy. Really important. Lots of perceived benefits of these water development programs. However, they can have unintended consequences, especially with neglected tropical diseases, of course with other diseases as well, but when it comes to schistosomiasis, they can really expand the transmission sites for schistosomiasis. So there are some really well-documented examples, and just to mention one, talking about the Diama Dam and the Senegal River Basin, that when that was set up, that stopped brackish water, it increased snail habitat, it increased human water contact, and it also removed the natural predator of the snails, which was a freshwater shrimp, or prawn. And then if you looked at prior to the construction of the dam, you had Schistosoma hematobium, urogenital schistosomiasis, in the area, but it was relatively low. After the construction, you got a new species of snail that came in and established itself, which could transmit Schistosoma mantonii, and you also had an expansion of the snail that harbored Schistosoma hematobium. So there was both an outbreak of Schistosoma mantonii, a species of schistosome that wasn't there before. So there was an outbreak in the human population of intestinal schistosomiasis, and there was a huge increase of urogenital schistosomiasis in the area. And still in this area, infections with schistosomes are incredibly prevalent. So these are the unintended consequences that really, if any water development is about to happen in an area, they really need to reach out to the NTD community and see what the risks could be. Looking at sanitation, this has already really been mentioned, but to look at it from a schisto sort of perspective, you need to consider what will your sanitation intervention do in different settings as well. So if you think about, if you have a sanitation infrastructure where you aim to reduce contamination of eggs in a water body where there are snails, you could put in a few systems in place, and that could be great. But the reality is that you only need one Myristidium to successfully infect a snail, and then you could have local transmission. So just one Myristidia will lead to thousands of cercariae coming out of a snail, and that could mean that that water site is now constantly a transmission site. Something that Mike Templeton actually really brought home to me was that sanitation, and has been mentioned before, sanitation might need to be in terms of universal coverage in order to have an impact on the schistosomiasis prevalence in the area. So that's something to be aware of. And then, of course, there are the usual problems with sanitation about it being well maintained and it being pleasant to use, so that people prefer to use latrines or want to maintain their local sanitation infrastructure. Looking at water contact behavior and transmission, really need to identify the different types of water contact behavior that leads to schistosomiasis transmission. So there's personal hygiene. So people will go and bathe themselves in an open water source or close to an open water source. And because these eggs can remain on the skin around, for example, the rectal area or the genital area, when they go and bathe themselves, they could be actually releasing eggs into the environment and at the same time also exposing themselves to infection. So that's something to consider. And then with domestic work, of course, get loads of people doing their washing and dishwashing and domestic chores in open water areas. Children play in outdoors a lot more in these areas than potentially our children do in our society, unfortunately. But playing in the water does actually increase the risk of these kids becoming infected, as does occupation that involves water. So fishing, rice production, crop irrigation, car and bike washers, but also herders, who a lot of the time are children, herders bringing their cattle and sheep to drink water, that they will also get exposed. So we really need to identify what behavior we want to change, what's the most effective behavior change that we can implement, and how do we change it as well. An interesting example of someone who's looked into this through the Zanzibar Elimination for Schistosomiasis Transmission, the ZEST program. They looked at 3 study arms: mass drug administration with praziquantel alone, mass drug administration and snail control, and mass drug administration and behavior change. And the behavioral scientist, Dr. Bobby Person, what she used was a human-centered design approach. And that basically means that she approached the communities with the behavioral teams and worked with them in both the design and the implementation of the behavioral change intervention. So they started by conducting interviews and discussions with the community to listen to what the community has to say. If the community doesn't think the schistosomiasis is a priority, you're not going to get them to change their behavior. So really you need to listen to what they have to say, and you need to also bring to them why this is important to them, to their lives. So that's something that Bobby did extremely well with the behavioral teams. And partnered together, they looked at what they found with the interviews, and they looked at how to create behavioral interventions that would mean something to the community and that could be implemented by the community itself. So they delivered these interventions, and these were school days, teacher tools, teaching tools in schools, as well as suggestions from the community that they wanted washing platforms where they would be able to access safe water, but not have to sit in water, and where there would be somewhere comfortable where they could do their domestic chores and also socialize at the same time. So these washing platforms were in fact implemented as well. I really do encourage you to read Bobby's paper on this. It's really interesting. Something else to think about is that we want to implement all these wash interventions, but we need to have better ways of measuring whether or not they work, and which ones work in different settings. Now, is looking at the prevalence of the disease enough, or do we need a better indicator, and do we need different indicators depending on the level of prevalence in a community, so high versus low? And can we use environmental DNA? This is something that Mike will touch on and that we will also speak about in the workshop this afternoon, so please do come. So just some final thoughts, really. You can feel free to ignore them if you want, but water development systems affect snails and also affect human water contact behavior. So if there are any water development plans, really do reach out to the local NTD experts to find out about the risk. And also provision of water access points through taps and wells, really have to make sure that that doesn't create new snail habitats, such as in this top picture, where you could potentially have schistosomiasis transmission occurring around these taps. The impact of sanitation may depend on the setting that it's in, whether it's a low prevalence area or a high prevalence area, and it may need to be universal in order for it to have a full impact. And as well, we need better measures for better indicators for measuring this impact. Something else that's a little bit of a complaint of mine, washing hands does not prevent schistosomiasis. So I've heard people say this, and unfortunately that's not the case. That's not to say you shouldn't encourage washing hands. Absolutely you should, but it won't in itself prevent schistosomiasis. And often you'll see people going into a local lake and washing their hands in a local lake. So whilst they're getting rid of whatever is on their hands, they're in fact exposing themselves to schistosomiasis. So just adding that. And then also, let's not forget that it is actually also a disease of huge veterinary importance, and that might also have, wash might also have a role to play in this as well. So, thank you. Is that okay for time?